Welcome to another case study from Renew Education. Please join us. This is a very good, straightforward case for an all-on-4 model for the bottom arch. Clearly the patient's missing more than half their teeth, so this is recommended to solve this not by a tooth-by-tooth situation or a multiple implants, when you could do 4 to 6 implants on the bottom and come out ahead of the game. These are pretty beat up teeth as well. There's a very deep filling here. So no matter what, you don't want to keep them. But here's an interesting idea. If you did, these are premolars. It looks like a premolar to me there. You could do an implant here. You could do an implant here if the bone is good enough, and then you would be doing a molar implant here, and you would do a molar implant back here. So that's kind of an interesting scenario to solve this, to do a bridge piece with single and single, provided you actually have the bone, or that's something that the patient actually wants to be with these natural teeth. The problem with the natural teeth in this scenario, the reality is that these natural teeth are going to have more problems in the very near future anyway, so you've got to end up focusing on a full arch case in reality. But if these were pristine, that might be an opportunity. So let's look at the treatment assessment that we do. We've got a nice bone density here. We've got a green, we got facial bone is orange, we got constriction is yellow, detached gingiva is green, and the sinus bone, we're not going to talk about that. Nerve position is very good. It's in the green because it's pretty low. The interesting thing here is when we get over to the vertical dimension, it's actually maintained. So we have no posterior support really, except the premolars, and that's in orange, but then we have a decent vertical dimension because when this patient actually bites down here, they actually maintain a very good distance between the lower arch and the opposing posterior teeth that are still remaining. And so the vertical dimension is actually held, and the position of where she bites actually is held. So it's kind of a funny scenario for the lack of the teeth that she has, that she's actually balanced things out pretty well. So let's look at this from a perspective of, do we want to do an angled implant, or do we want to do all on 4? Do we want to do all on 6? So I think I treatment plan something of all on 4, but look at why this is what I call a starter full arch case. So even a starter full arch case goes into a skilled level. This means that you should have already been placed over 50 to 100 implants at this point, single tooth replacement, and here you're going to be tackling 4 to 6 at a time. But look at how good that bone actually is, and look how wide that arch actually is. Let's look at it from the CT point of view. Not too shabby here. This looks really excellent, and you've got quality bone. It's not too bad here at all. You can do compressive technique. You got a very wide ridge. You don't have to worry about the nerve. And so you can get implants in here. Let's look at the anterior a little bit more. We got a bit of a constriction here going on, but still high quality bone. If I go a little bit straighter into the arch, we're going to get right ahead here. We're going to go right into this. This is where you lose it. This is where the constriction really throws things off. So like I started out in the beginning, if you could put an implant in that position right here, that's fine. But look at where I'm at and look at what I've got. I don't really have a good scenario unless I trim all this away. That is not wide enough for an implant, and it does throw off the prosthetic. Your prosthetic support right now is here, going up here. When you augment that back, your support now drops back to something like this. And let's see if we can do that. So 1, you have now a higher height, but 2, you're now going further back. This actually does matter when your incisal edge is here and your support is here versus there. So that unfortunately does affect the person's loading on a hybrid, loading on an overdenture, loading on anything that you put in that area. So I like to keep that. So what would we do here? Let's see, I did put some implants in. I would be looking at probably 4 implant solution. Let's do that. I think these first 4 are the implants we put in when we talk to the patient. So you're going to have to move this implant into this premolar position, and it looks like we've got a lot of room over here in the canine position on number 22 site. So yes, we do. So unfortunately, this is the poor constricted affected area on the healed side, but we do have implants available here. So this looks a little bit, I would probably even put that a little further back. Let's see which one that is. Yeah, let's look at that. That is a 4.2 by 11. I think this is a pretty wide area if I remember. Let's do that. And let's center that back. Yeah, that looks better. We got plenty of room here. Plenty of bone and space. So this is what I would recommend ending up doing. I wouldn't jump into that. And this is the interesting fact, is that you actually still have a very good 4-legged stool supportive prosthetic. Do you need to go further back? Not really. If you move that back, it wouldn't hurt. It might balance a little bit more. But you got to mind yourself to what you're actually occluding to. The patient has to follow up with the other care, and you're looking at really restoring into the primary chewing area, which would be from here basically to out here. So that's all great, fine. Yeah, that must be a canine then for sure. That's there. But anyway, this is what you're looking at in terms of a simple, straightforward overdenture case. Yes, you can do a hybrid here. I don't recommend, I don't like doing hybrids. I don't like how they can break on you too fast. Your problem comes down to this anterior support. Is this enough to cantilever these back locators? You're going to have to put probably the medium to the hard one, because the patient's always going to want to bind on the front, especially if they don't restore the posterior back here. So this kind of patient that doesn't restore the upper, sticks with the partial denture, you're going to have problems with them only chewing on the anterior and creating that cantilever effect, because your lower front arch, if you augment this back, now you're going to create more of a cantilever. You're not going to have that support. So you definitely want to not change that too much here. You want full support all the way for that front loading, because they're going to bite on their front teeth. Happens all the time. If you want to do 6 implants here, you've got plenty of bone from here back. You've got plenty of bone from here back. Go for it. If you want to add the 2 other implants to secure it, whether it's a hybrid, whether it's an overbar, whether it's locators, it will all work. And as long as they keep it clean, it should work a very long time. So thanks for joining on this case study. Take a look at the upper video as well. It's called Sinus Step. But look at our other case studies. There's plenty to look at. We have in the hundreds now. So you want to learn more, log into our website, check out our subscriptions that we have there. Like us on Facebook and subscribe to us on YouTube.